The title of my project is a comparison of most of these prompting and error correction in teaching a child diagnosed with autism receptive labeling during discrete child training. The participant for my project was a 5-year-old girl diagnosed with autism. We were in an ABA clinical setting with toys and activities around for reinforcement. My research question was which prompting procedure will increase the number of correct responses when teaching receptive labeling during DTT, either most to least prompting or error correction. 8 2D stimuli was separated into two sets for each prompting procedure, 4 for error correction and 4 for most least prompting, with the total of correct responses was divided by the total of trials per target, which was 5 trials each. During baseline, there was no procedures implemented. During baseline, I presented 3 SD stimuli cards to the participant, with also giving them the SD of show me, touch the target. The average of each procedure was pretty low or 0. During the error correction procedure, I presented an array of 3 cards to the participant and also repeated the SD touch me, show me with the target. For correct responses, giving the participant was allowed access to the reinforcement for 7 to 10 seconds before removal. If an incorrect response was implemented during the error correction procedure, the SD would be presented again, and a physical prompt will be given to the learner to touch the correct targeted response. And following that, 2 distractor trials will also be given to the learner. Distractor trials are previously master trials that she already knows, which was chair and airplane. For most and least prompting, again, an array of 3 2D stimuli was presented to the participant. The SD stated, touch, show me the target. If the learner did the correct response, she accessed the reinforcement for 7 to 10 seconds. If she did not say the correct response, then most of these prompting will begin, which will be the first prompt will be the most intrusive prompt, followed by the less partial physical and gesturing, and whichever one was appropriate for this response. Um, During the interventions, you can see by looking at the graph that both procedures did have an increased trend. But the error correction, she did reach 100% mastery criteria the fastest over most elites prompting. So while they both increased, one did show results quicker than the other. So I would agree that error correction would increase the correct responses in receptive labeling during discrete child training. And I think that would be the most beneficial to use when creating skill acquisition for your learners, and to prevent any stagnant in mastering out goals. It's best to always implement the best prompting procedure, which in this case was error correction. Some limitations I had during my session was I didn't use different stimuli cards for the different targets. And I have the targets listed in my methods if anyone was interested in which targets was for error correction and which targets was for most least prompting. I think that would have made some type of difference is changing up the cards used. And that concludes my presentation. Thank you.